Well, hello, everyone. Thank you so much for taking time out of your day to sit and chat with us. My name is Michelle Caliri. I am currently a senior living advisor with Senior Living Experts. I am joined today by Robin Dawson. She is going to be able to tell us a little bit about herself, but she is everything Medicare. So Robin, go ahead and give us a little bit about you and what you do.
Yeah, so I am an independent health insurance broker at Medicare Solutions Network. We help provide no-fee consultation, plan evaluation, and enrollment assistance for people who are either embarking upon Medicare for the first time or needing to just get some guidance around changing their coverage throughout the aging process.
So I know that it's open enrollment right now, and I believe that's through mid-December, so correct me if I'm wrong. With that being said, everybody's getting bombarded with commercials on TV, commercials on the radio about the different products and benefits that are available. For somebody who's brand new and just turning 65 and just getting into Medicare, what's their best option? Is it staying on group insurance? Is it enrolling in just a Medicare Advantage plan? What are those usual recommendations you make for first timers?
Well, I think the first thing to point out is that this time of year, between October 15th and December 7th, that's the annual enrollment period for people who are already in Medicare. It's their opportunity to change calendar year plans such as Medicare Part D, Medicare Part C, which is also known as Medicare Advantage, or to move between original Medicare and Medicare Advantage. For somebody who's new coming into their Medicare eligibility, maybe they're turning 65 and they're reaching their eligibility for the first time, or maybe they're 68 or 72 and they're finally deciding to retire. This time of year doesn't apply to them. They get either an initial enrollment that's 7 months around their 65th birthday, where they can come to Medicare, turn on their Part A and B benefits, and choose other coverage and step away from whatever previous coverage they've had. Or if they're retiring later, they're going to have a special enrollment period where they can do that same thing at the time that they designate they want to step off of their group plan. But really, to answer the second part of your question, which is what do I advise? It's really what's best for that individual. So what I'll do is I'll meet with a person, we'll have a needs assessment, a conversation about who are their doctors? What's important to them in terms of moving through the healthcare system? Do they need access to every doctor that accepts Medicare, or are they perfectly fine working within a managed care network? Maybe they're used to being on an HMO plan and they do everything with one medical group. Or maybe they need some flexibility to have a PPO plan where they can go in and out of network. They don't need referral from their primary care doctor, but this is a very interesting time in a person's life, because when they come to Medicare and then throughout their journey in Medicare, they're making these decisions for themselves. And prior to this point, most of us are coming from group insurance, and all that's been negotiated for us in the background, right? Deductibles and co-insurance and doctor networks. And we're pretty much given an option to take it or leave it, right? So there's a lot that people need to consider when they first come to Medicare and as they age and their healthcare needs change, because our healthcare is very dynamic and it's unique to us. So I usually always counsel people to take the advice of friends and family. They mean you well, of course, but your health is not their health. Your budget is not their budget. Your doctors are not their doctors. So to really embark upon this journey with your individual needs in mind, and then we can talk about which path is the best path, whether it's Advantage, whether it's original Medicare with a supplement and a drug plan, really what is the best design for them as an individual.
For somebody who's seasoned, who's been doing this for a couple of years, let's say they're extremely happy with their plan, but open enrollment is upon them. Is it still advantageous for them to at least have a conversation with you to make sure that they're getting everything that they receive? Or maybe there's something new that they don't know about?
I mean, here's the thing. The good news is we live in a very competitive insurance market in the state of Illinois. The bad news is we live in a very competitive insurance market in the state of Illinois. And so as a result of that, the advertising is at an all-time high this time of year. People think that they need to make a change, but you brought up something very important, which is if someone's really thinking about themselves and thinking about, have I had any changes to my doctors? Have I had any changes to my medications? Have I had any changes to my budget or my life circumstance where I need my healthcare to be operating different for me? If the answer to any of those questions is yes, then certainly now is a great time, this time of year, to review your coverage. If the answer is no, I'm kind of the mindset, if it isn't broke, you don't fix it. Everything in Medicare automatically renews for the next plan year. People don't have to re-enroll in anything. They just have to keep paying their plan premiums, and everything will roll over into the next calendar year.
So let's talk a little bit about Medicare Advantage plans.
Mm-hmm.
What are Medicare Advantage plans? How do they work? And then a Medigap plan. What are those and how do they work?
So a Medicare Advantage plan in the insurance industry, we like to call those Medicare replacement plans. Medicare calls them Part C, but those plans are a private insurance product that has contracted with the federal government to take over for your care. So now instead of the federal government, the Medicare system being your primary insurance, a private insurance company is your primary insurer. They're going to pay all your bills and cost share with you based on decisions that they've made about how you're going to contribute to the cost for your care. What they have to provide you by law, because they've taken over for Medicare, is everything under Part A, everything under Part D, and most often they include a qualified Part D prescription drug plan. So you are getting all the benefits you get with Medicare in a Medicare Advantage plan, and you are getting maybe some extra benefits from a preventative care standpoint that Medicare leaves you open to self-insure for, but how you pay for it is different. Because usually when someone is in original Medicare, and Medicare, the government is getting all their bills when they use the healthcare system, they've got a private insurance product, a Medigap plan, a supplement, standing behind Medicare as a secondary bill payer. And there's various types of plans they can buy at various different costs to support them in their out-of-pocket expenses that Medicare makes them responsible for. But in that world, they get to see any doctor anywhere in the US that accepts Medicare. But when you're in a Medicare Advantage plan, the first thing you have to know is that those plans are tied to a doctor network. So maybe it is a PPO, which gives you, broader network access, or maybe it's an HMO where you're doing everything within a single medical group. And either is a certainly fine choice, but it's an individual choice. But everything you do in the healthcare system beyond your preventive care, you'll have some associated copay for. Mm-hmm. So depending on what the plan has determined, you'll have a copay for office visits, a copay for a night in the ER, a copay to see your specialist, a copay for a lab test and a diagnostic test, and so on and so forth. So if you share in the cost of your care a little differently in a Medicare Advantage plan than you do in Medicare itself. And there is a max out of pocket on Medicare Advantage plans. So as you're contributing to the cost of your care, that's counting towards some max number. And you should feel comfortable with that number because it's your worst case scenario.
So correct me if I'm wrong, a Medicare Advantage plan is going to look a lot more like an employment group plan that you were part of when you were working. And then your Medigap plan is there to support your Medicare coverage and help incur some of the costs that you might still incur after Medicare is done paying their portion.
You got it. The one thing I will say about Advantage that will look a little bit different or feel a little bit different than an employer group plan is it's based on the Medicare reimbursement model. So that's the good news because costs are going to be far reduced than what most people are used to paying for. And in the state of Illinois, this year and in the year to come in 2022, most Advantage plans don't have a medical deductible. So day one, dime one, you're sharing in the cost of your care if you're on an Advantage plan. Sometimes there's a drug deductible for the Part D prescription drug coverage piece. So, it is a very economical way for some people to go about paying for their health care if they want to keep their monthly fixed cost for insurance relatively low. But make no mistake about it, when you start to use the healthcare system on an Advantage plan, you will pay out of pocket for certain things.
So Robin, how do people get a hold of you if they're ready to jump in and start working with you?
You can either check our website at MedicareSolutionsNetwork.com, or you can email me at Robin, and I spell my name with an I, Robin at MedicareSolutionsNetwork.com, or you can call our phone number. My cell is 773-718-4604, and then our office number's on the website. I'm extension 3. Check out our website even outside of these months, because we do a lot of public speaking, my colleagues and I, and we always have a listing of our seminars posted.
Well, that's a huge resource as well, because I do know that you're very, very busy this time of year. I just want to let everyone know, if they ever need to get a hold of me, you can go to seniorlivingexperts.com. My email address is very simple. It's my first name, Michelle, with 2 L's, at seniorlivingexperts.com. And my direct line, which is my work cell phone, is 773-964-0409. Robin, thank you so much for joining me today.
Thanks
I
for
truly
having me.
appreciate it.